Okay, so this is my mini study analysis table. My name is Alexandra Klein, and my research topic is, does exclusive breastfeeding change postpartum depression outcomes for women? And so I chose this topic just because of my own passion with breastfeeding. I'm a breastfeeding mom myself currently, and I just want to learn more about postpartum depression and how it relates to breastfeeding. I found this might be a way to encourage mothers to want to breastfeed, but also help to support mothers through their postpartum depression and help prevent it and help them through it to hopefully get better exclusively breastfeeding mothers. Yeah, in my practice. So, over the three different research articles I looked at, the first one was looking at the association between maternal satisfaction with breastfeeding and postpartum depression symptoms. So this chose 287 women from one public and one private hospital during the 6 weeks postpartum period. And this happened in Brazil. It was a cross-sectional study within a cohort study. And data was collected by going to the homes of these 287 women, and they did an in-person survey at 37 days postpartum, and they were given a questionnaire that they came up with themselves, the maternal breastfeeding evaluation scale, and the Edinburgh postnatal depression scale. So they went all over three things with them while they were there in their homes. And the conclusions of this study found that high satisfaction with breastfeeding was 47% higher in women who were not experiencing postpartum depression. And weaknesses I felt were that they only reviewed these women once, and these results were a little confusing to read. And the strengths were the three different questionnaires gathered a large amount of information to try to gather what they were really feeling and going through, and they chose a public and private hospital, which would give them a more diverse group of women. And the second study I looked at two things. So the first thing was they looked at the risk of postpartum depression in moms who quit exclusively breastfeeding before the 6-month mark, compared to moms who exclusively breastfed to at least 6 months. So this study also explores how maternal stress and social support moderated and mediated the relationship between postpartum depression and exclusive breastfeeding. So this study used 426 moms in Bangladesh, and this was at the 6-month mark postpartum. And they would have surveyed only the moms who brought their babies in to receive immunizations from the government services, and these were married women from ages 15 to 49 years old. And then this was a cross-sectional study done within 3 months, and I used a random sample. And this study also came from a much larger study that looked more into intimate partner violence, and these were the findings from this study. And this was also a face-to-face survey. And what they found was non-exclusively breastfeeding mothers, so women who were not exclusively breastfeeding, were 7.58-fold more likely to experience postpartum depression than the exclusively breastfeeding moms. And then the other part that they were looking at with maternal stress, they found that moms with low maternal stress were still more likely to experience postpartum depression when they were not exclusively breastfeeding. So I did think that was interesting. Weaknesses were they only interviewed these women once, but strengths are it was a random sample, it was a large sample size, and the face-to-face survey would have helped to get a good understanding of what these women were going through. And lastly, this study explores postpartum depression occurrence and exclusive breastfeeding. So this was the largest sample size. It was 2,583 mother-child dyad, ages 15 days to 3 months were the infants. It was a cross-sectional study. It also helped control for confounding variables. It was also done in person, and they went through the Cohen's previewed stress scale, the Chance 10 item scale, and controlled for prior depression and sexual abuse. So their conclusions found that 50.8% of the mothers were exclusively breastfeeding at the time of the interview, and of those 50%, only 11.8% of those mothers were experiencing postpartum depression symptoms. And postpartum depression will reduce the chance of the breastfeeding. So this kind of looked at the other end of if you have postpartum depression, you're most likely to stop exclusively breastfeeding. So weaknesses in this were they only interviewed once, but they did control for confounding variables, and it was the largest sample size. So overall, I think they did pretty good at doing the in-person interviews. I think this was probably a good way to get this kind of research. And that is my mini study analysis table.